Welcome, Libby, and thank you so much for tuning in to the Byogi webinar series.
Great. Thanks for having me. And thanks for that nice intro, and welcome everybody. I'm seeing all of your names scroll by on the chat, and I recognize some of your names, so that's kind of exciting too. So yeah, I'm Libby Hinsley. I'm really happy to be here. We have just 1 hour, and if you know me, you know I like to talk a lot, so it's going to be a challenge for me to get everything in that I want to say in 1 hour, but we're going to do our best. And I'll just say that it'll just be a little intro, a little taste, and then I'll give you some ways to stay in touch with me so that hopefully you can carry on if it sparks your interest and is relevant for your goals and such. So I'm just going to get right into it. Shannon did a great job introducing me. My yoga background kind of led me into physical therapy, and that's led me into personal training and discovery that I have a connective tissue disorder that causes hypermobility. And so over the last, say, 5 years, hypermobility has really become my my world, really my life, and a big theme of what I'm doing in my work as well. So today's workshop is really about an introduction to strength training generally for yoga people. However, I will talk a little bit specifically about hypermobility, and I'll just say if you're really interested in hypermobility more, you should check out my book. It'll give you a great background, lots more background than we're going to get into today. But let me pull up my slides and I will just jump right in. I'm located in Asheville, North Carolina. I noticed that there are some other people from North Carolina in here today, so we're neighbors. And I've got a slideshow here. Hopefully y'all can see that just fine. I'm going to go through it, and you'll have it to refer back to later when you get the recording of the webinar. So strength training for yogis, that's you. And you may actually not be much of a yoga person, and actually whoever you are, it's great. It's great that you're here. But we're going to get into this topic because I get a lot of questions from my yoga teacher students about wanting to get into strength training. There's a lot of good reasons to want to get into strength training if you're a yoga practitioner, whether it's to enhance your yoga practice or just to supplement your life. I think we get really different things out of yoga practice versus like a strength training program. So we'll kind of talk about where those things converge and where they really diverge too. So what is strength training? Why should we do it? Where do we start? How do we progress? Like, it's a whole world unto itself. And sometimes we think about strength training as just like, go grab that 5-pound dumbbell and do some things with it. But really, strength training is like a very well thought out, methodical, progressive process. Just a side note, I am moving my house this weekend. So in the background, there are boxes. I just want to point that out. It's bothering me a little bit in the frame, but that's just what that is. So I just thought I'd tell you. All right, so let's first talk about basic principles. What is strength training? Well, sometimes it's called resistance training. Sometimes it's called weight training. Those are all the same thing. And they're just referring to ways that we can use resistance to build strength. Now we're going to get into what is strength. What does that mean? But basically the idea is that we're using resistance, and we can start with our body weight. And then me moving my body around in the world, I don't have a lot of external load resisting my body right now. Really, all I have is gravity. And in yoga asana practice, that's what we've got. And now, unless you're bringing in other things like weights into your yoga practice, you've got body weight and you've got gravity. That's it. When we do strength training, we're really talking about adding external loads to that. So in addition to gravity, we're going to be dealing with things like resistance bands, like TheraBands, like dumbbells, like kettlebells or barbells, those types of things. Okay. So what is strength really? Strength is defined as our ability to move a load. Okay. So, how heavy a box can I pick up from the floor? That's how strong I am in picking up boxes. So how strong we are determines how heavy a load we can move with any specific task. How much can I squat? How much can I lift? That type of thing. How much can I push or pull? That's my strength. Now, stability is different. And these things get confused a lot of times, but they really are different things, even though they occur together. So stability is our ability to actually resist movement under a load. So this friend here really loves hanging out in this plank pose, but that's a great example of stability. So he's in this plank pose, not moving. Okay. The goal of stability is not moving against the load, which is gravity in this case. So in most physical tasks, there's like a stable part of the body and there's a moving part of the body. So I'll give you an example. I'm going to use the deadlift as an example. This is going to be one of our main examples throughout the whole talk today, but I'm going to just jump up and do a deadlift movement for you real quick. And I'll show you that there's a part of my body moving and a part that is specifically not moving. So I'm gonna get in the frame as much as I can so you can see most of me. So my deadlift movement is hip hinge and then back up. So I'm moving at my hips, right? The moving muscles are my butt muscles and my hamstrings. They're doing this movement. But then I've got all this stability going on in my trunk. I'm not collapsing, I'm not wiggling. I'm specifically not moving my spine. It's staying stable, okay? So I didn't even add any load to that, but that's an example of there's a moving part, there's a stable part. That's almost always the case. The moving part's using my muscles to generate the force to do that movement. The stable part uses different muscles, usually smaller muscles, to resist movement under that same load. So in that case, my little spinal stabilizers and all my trunk muscles, my abdominals, especially my little segmental stabilizers of my spine, were working to prevent movement of the spine. Strength and stability training are not separate. If you remember just one thing from this whole talk, I hope that's one of the things you remember. These things go together. I was teaching a workshop on strength training recently, and someone was like, well, what do you do for core stability? And I said, this is what I do for core stability. Now we can do things like planks and some accessory exercises, but for me to be able to squat something heavy, I have to be that stable also under that same load. So hope you'll think about them as integrated. Okay. So let's think about yoga asana. And does yoga asana improve our strength? Like, is yoga a modality for strength training? Well, like I mentioned before, really the only external load we have in yoga asana is gravity, unless you're bringing in resistance bands and dumbbells and things like that. We have our body weight moving against gravity. We're able to push against the floor or against the wall, but we generally don't have anything to pull on, right? So we're limited in our pulling. We can do a little pushing. So asana does give us some opportunity for practicing stability against pretty minimal external load. And it gives us some opportunities for developing some muscle endurance under low loads, right? So when I think about holding a challenging posture like Warrior 3, which in strength training we could call a single leg deadlift, like our friend here in this picture, like that's going to help develop some muscular endurance for sure. That's hard work for my muscles to hold me in that position, for any length of time, whether it's 5 breaths or whatever. But there's not a lot of load involved. So yoga asana is limited when it comes to building strength, to really building strength under external loads. There's just a limit that we're going to reach. Now, can we incorporate strength training into yoga asana practice? Sure can, and people do. I've seen a lot of people bring in resistance bands, dumbbells, sandbags are kind of a nice option because a lot of yoga studios already have sandbags and you could pile those on and do things with those. But mostly we're, again, using our body weight as our resistance in gravity as our resistance. I will say there's a benefit to bringing resistance into your yoga practice beyond strength training. And that is simply that when we push on something or get under some resistance or pull on a band or, feel something heavy in our hands, it gives us some sensory awareness that we may not have had before we got under that resistance. And that can feel really interesting for people from more of like a sensory perspective and a proprioceptive body awareness perspective. So that's a side note that there may be some reasons why you might be interested in resistance other than just like building brute strength. Okay. So the other question we could ask is, can we design our yoga practice to optimize strength and stability? For sure, we could do that too, right? We could choose in our practice to do the types of postures that require a little bit more muscular effort. We can hold postures for longer. We can incorporate more of those stability types of postures like planks and side planks and bird dogs and all of that stuff, right? Like we could definitely choose our postures to really orient our practice towards more muscular effort. More muscular effort is going to fatigue our muscles more, and that helps them get stronger. So there certainly are some strength benefits that we can get out of the yoga practice. However, sorry, let me scoot this chat over. There we go. I think it does come with some inherent limitations. I think one of you just may have mentioned in the chat. Number one, as yoga teachers, we're not really, unless we're additionally trained in like strength training, we don't really know what we're doing. So that's a problem. Could be a problem. So you want to kind of know what you're bringing into your class. But I also think that trying to really, in a meaningful way, integrate strength training into a yoga practice by itself comes with some inherent limitations. So number one, if you're a studio or offering a class with 10 or 20 people, and you're thinking, I'm going to provide dumbbells for all these people, well, that is going to get costly really quick. The most cost-effective method to bring in would be resistance bands, because those are pretty affordable, pretty accessible. They don't take up a lot of space. But things like dumbbells, when you're thinking about different increments of weight, 5, 8, 10, 12, 15, 20, 25, like having a bunch of sets of those for each of your students is not really feasible in most cases. I think another thing to emphasize, and I won't spend a ton of time on it, but I do think it's an important thing to reflect on is, making our yoga practice more explicitly about fitness, I do think risks losing the purpose of yoga practice, because yoga practice in itself isn't that interested in your fitness that much, right? Yoga has much broader interests in your journey as a human being and your consciousness and your how you live and choices you make and your relationship to yourself and all these really good things that yoga is about, right? That actually have nothing to do with strength training. So I do think that that's a good question for all of us as yoga practitioners and teachers to kind of reflect on is, well, what role is my yoga practice playing in my life? And this was a real turning point for me in my yoga journey. My yoga journey has been interesting because I had a lot of injuries and pain related to my yoga practice for many, many years. And I don't anymore because I learned about my body more and kind of how to practice to support it. But for a long time, I just didn't know that. And I was practicing in ways that really weren't well suited for my needs. And that was a problem. But I was also treating my yoga practice as my fitness program too. And I was asking a lot of the yoga practice for my life. And when I split yoga over and put it into just yoga, and I let my fitness come from other things like the gym, where I started getting to strength training, things really changed at that point for the better. Not only did my fitness go better because I really needed the support of strength training for my hypermobile body, but my yoga practice became much more enjoyable, more gentle, kind of a sweeter like friend for me, for my life. It became much more supportive and not so much of a chore or a place to beat myself up, actually. So it was really interesting to watch that happen. So I'll encourage you to ponder that. But nonetheless, I do think that yoga class can be an interesting way to introduce people to resistance. And I think it's a fabulous starting point. What we're going to talk about for the rest of our time is, how do we, if yeah, we can get into resistance bands and kind of like treat our yoga practice in some ways, doing some exercises with bands and whatnot. But if we really want to get into strength training because we see its benefit for our life and for supplementing our yoga practice, then what does that look like? So those are our bigger questions for today. Yeah, I'm just checking out the chat a little bit. Yeah, like a yoga strap. So that's a great thing that could give you some resistance in certain planes. I mean, you can pull on it, right? You could like hook the strap around your foot or around an object that doesn't move and pull on it. So that is a good way to get some pulling. That's true. And actually, I had a friend tell me one time that they had partner pairs in their yoga class kind of do a tug of war on a blanket or a strap. Like, so there are some creative ways you can use props to get a sense of that some pulling against resistance. But it's tough, right? It's tough. I can recommend some I'm not catching or I'm not remembering their name now, but there are a couple people out there who have some specific resistance band programs that are yoga based that I would recommend. And if I think of their name, I'll tell you. Okay, so let's get into what are the benefits of strength training? Like, why do we care about strength training? Well, muscle strength turns out to be really important, like really important as we age, especially. For like an aging body to stay independent, we need to be training for our old age. And sarcopenia is a fancy word that just means muscle wasting. And it just is what's happening to our body as we get older. And we are fighting a losing battle on muscle mass generation as we age. So sarcopenia is a real thing. We are going to have some muscle wasting that's age related, and we're trying to kind of keep up with it and maybe even surpass it with our strength training so that we have improved functional capacity when we get old. When I'm old, I mean, I'm almost 50, I'm in my late 40s. When I'm, 60, 70, 80, if I'm lucky enough to live a long time, I want to be able to travel. I want to be able to go on a walk. I want to be able to take my suitcase and put it in the overhead bin. I want to be able to do functional things that are important in daily life. And that's really why we do strength training. Muscle mass is associated with cognitive health in aging. Bone density is a big reason a lot of people are interested in strength training too. We know that at higher RPEs, we'll talk about that word, higher rates of exertion, harder, heavier loads is basically how we could translate that. We know that we get some improved bone density outcomes with strength training, but it's not going to happen with a 5-pound weight. It's not going to happen with a little resistance band. This is where we need progressive overload and heavier weights. Joint protection. Let's say I'm hypermobile and I have wobbly joints, or maybe I even dislocate them sometimes. Stronger muscles around those joints are protective. They support those. And that can be really protective for me to continue my yoga practice. Like if I'm getting stronger over here, then now maybe I'm at a little less risk for tweaks and injuries when I get over to the yoga mat. So on the other thing about hypermobility is connective tissue adaptations, improved stiffness. When we have hypermobility syndromes, we've got this floppy collagen, floppy connective tissue that actually can change under loads. It gets stronger under loads, it gets stiffer. And it's funny to say that we want more stiffness, but for the hypermobile person, we kind of do. We want more tendon stiffness. And that improves the way that connective tissue, our fascia, our tendons, our ligaments, is able to transmit force across our body, because that's one of the big functions of connective tissue, mechanically speaking. So super important. Metabolic health. We know that strength training and building muscle mass improves our insulin sensitivity, our blood sugar regulation. Muscles turn out to be metabolic magic machines. They do much more than just contract and move things around. They're important physiologically in the background too. So I mentioned longevity. So we got lots of good reasons to care about this, right? Rounding out your practice, rounding out your self-care, allows you again to separate your yoga into yoga and fitness into some other things, perhaps. What's cool about yogis is that they already have a mindset for consistency. You're already really tuned into this idea of practice, of consistent practice over time. And that's really what strength training requires of you as well. So you're kind of set up for it. And you already have a really keen sense of body awareness, which is going to serve you really, really well as well. Okay, so let's talk about what's the difference between strength training and stretching. Like, is it different? We think of it as different stuff, don't we? But it turns out it's all the same load. So when we think about tissues and we think about, say, a muscle has attachment sites, one on each end of the muscle. Some muscles aren't that simple, but you get the idea. When we pull on that muscle, like when we stretch it, what happens is those attachment sites get farther away from each other. Okay, that's what a stretch is. And when it gets as far apart as it can get, the muscle has spread out as far as it goes, that tissue is now under tension. It's a pulling apart force, right? Tension. That's what stretch is. Turns out when we contract that same muscle, the contraction of the muscle also pulls on its attachment sites, again, putting it under tension. So whether we are contracting muscles in a strength training setting or we are stretching muscles in a yoga setting, the load we are putting those tissues under is exactly the same. It's just all tension. Now, we might be putting them under tension at different points in our range of motion, but there may be some differences. And in strength training, we're putting them actually under more tension because we've got all this external load on top of that body weight. So that's just kind of interesting for you to open your mind up about what you're even doing in yoga practice. You're kind of already putting yourself under some tension there. And when we get in strength training, we're putting it under more load, and tissue responds to load. And what's really interesting is mechanical stress on tissues does not make them weaker. It actually makes them stronger. You've heard about this when it comes to bone density. You hear about weight bearing on bones being important because it stimulates the bones to get stronger, to make themselves stronger. Turns out that muscle also responds to mechanical stress by getting stronger, and so does connective tissue, actually. So challenge doesn't make our tissues weaker, makes them stronger. The key being the challenge has to be dosed in such a way that we can handle it, that we can adapt to it. Too much, too soon, now we're in injury zone. But if we can get the challenge just progressive and a little at a time, and we can make these adaptations, then we start getting stronger. All right, so this kind of helps us reframe our whole thinking about the body, sort of shift our thinking from sort of an overuse model of thinking to more of like I need to adapt in a certain way. So it kind of changes overuse to I'm just under adapted for this thing, right? So the human body is adaptable. So really keep that in mind. That's a big takeaway too. Adaptability. Again, the idea is dosing challenge so that you can adapt to it and not injure yourself. And that's really tricky. It sounds easy to do, and it's not. It's very person specific. That's what makes it so tricky. Oops, blank slide. Okay, so when we think about strength training here, we're going to think about big categories of exercises that I'll introduce to you. And these are our functional movement categories: squat, lift, push, pull, and carry. So now if you think about like daily life and kind of the tasks that humans do in life, this is pretty much it. We carry things, we lift things, we squat down and maybe pick things up that way. We push things and we pull things in a bunch of different planes, right? And so those are our categories, and we're going to build a strength training program around those. Let me give you some examples. In the lifting category, you'll find your standard deadlift, what our friend here is doing. It could be a Romanian deadlift, a sumo deadlift, a conventional deadlift, a split stance deadlift, a single leg deadlift, a walking deadlift. There's a bunch of different ways to deadlift, my favorite category of exercise. But that's all lifting, okay? And in a moment, I'll kind of demonstrate each of these for you just to give you an idea so you have a visual in your mind too. Squatting is a whole separate category. Back squat is what she's doing here in this picture. Front squat, goblet squat, split squat, a step up, a lateral lunge, a single leg squat. All of these are, would fit into the squatting category. So You're familiar with some of those probably. Pushing examples. Could do a push-up against the wall or on the floor. Bench press, floor press, which is a bench press on the floor, an incline press, an overhead press, dips, right, where we're kind of pushing down. So when I think of pushing, I can be pushing in all different planes. I can push down, I can push forward, I can push up, okay? Pulling is the same. I can pull down, I can pull towards me, I can pull upward. So all these different planes of pulling, any kind of row fits in this, any version of row, pull downs, high pulls, pull ups on a pull-up bar. Those would all be pulling examples. So we start to think about exercise not as like shoulder exercises or like knee exercises per se, but rather pushing or pulling exercises, squatting or lifting exercises. So each exercise in this paradigm becomes very much a whole body orchestra of pushing, pulling, squatting, lifting. Much more functional way to think about it. Carrying would be like a farmer carry, which is what this is called, or an overhead carry. Anything where you're carrying something. You could carry sandbags around the yoga room and you'd be doing a carry. There's a way to integrate the breath in strength training, which I think is really important too. So I'm just going to spend one slide on that. And then I'll show you in my examples sort of how to integrate the breath with this. But this puts you as a yoga practitioner kind of ahead of the game because you already are probably very familiar with the way that your breath works, right? And paying attention to the breath. But breath is really the foundation for core stability. For responsive core stability. And that's about managing pressure in your abdomen. Intra-abdominal pressure management starts with the breath. And we can use that to help our core and trunk stay stable during a lift, especially important when we're starting to lift a little heavier over time. So each exercise has a concentric phase and an eccentric phase. So just to refresh your memory about muscle contraction, muscles can contract and shorten when they do, like my biceps here is shortening when I lift something like that. That's a concentric contraction. And then an eccentric contraction would be, I'm holding a heavy set of therapy balls and I lower this down really slowly. So this muscle's still working, but it's getting longer while it works. That is called eccentric, okay? So each of these big exercises has a concentric phase and an eccentric phase. And it's a really good practice as you get into this to exhale on the concentric phase of the exercise. It may be the part that you think of as the exertion part, okay? This is going to help promote that dynamic core stability. As I exhale, my belly is automatically kind of drawing in to help brace my center. So I'm going to show you an example where I'm integrating the breath into each of these. I'm just going to do a lift, a squat, a push, and a pull so that you can see those categories, my favorite examples of each one, okay? So let me do that real quick. I had to get my different glasses on. So I'm going to start with the deadlift again, and I'll use weights this time, and I'll just show you, and I'll talk about how I'm breathing during that as well. Hi, you can see me mostly. Okay, I'm going to hold some weights here. I'm going to go from the side. Here's my deadlift. Hip hinge. My butt's out behind me. My spine is pretty straight. Movers are my hip muscles, my butt, and my hamstrings. That's a deadlift. I'm going to inhale here. Exhale to stand up. Okay. You don't have to breathe out your mouth. I'm just exaggerating so you can hear me. I'm inhaling here, and then I'm exhaling on the concentric phase to get back. As I come down, my glutes and my hamstrings are lengthening while they work. That's eccentric phase. And now I'm going to exhale as they shorten to get me up. Exhale, they shorten to get me up. Okay. So that's an example of the deadlift part. So let me show you that same thing with a squat. I prefer squatting to a surface. I'm going to use my chair. I know you can't see my head, but you can see most of me. Here's a goblet squat. I'm holding some weight at the front of my chest. I'm going to squat down nice and slow and controlled, and exhale to stand up. I'm inhaling on the way down. I'm going to use my quads and my glutes to stand me up on the exhale. And so coming up on the exhale helps my core engage naturally so that I have a little bit more stability here on my way up. Same thing goes for, I'll do my pulling. I'll do a row, a bent over row, okay? I'm inhaling here. I'm exhaling to pull. I'm pulling on a dumbbell using my shoulder blade muscles and my arm muscles. While this stays stable, this is all working too, just to hold me stable there. Exhale to pull. All right, and then let's say lastly, I'm doing a push. I'm going to do an overhead push since I'm right here in my seat. Same dumbbell, I'm going to inhale and exhale to push. Good control also, I'm demonstrating. I'll talk more about that in a few minutes, but exhale to push. So you can kind of get a sense of that exhale is on exertion. It also is the concentric phase of the exercise. All right. Okay. That's your little intro to lift, squat, push and pull. Just one example of each one. All right, and integrating the breath. So that's important. So when we think about, okay, we kind of know what strength training is. We know why we want to do it. There's a few elements that we can adjust about a strength training program, and that is frequency, volume, and intensity. Frequency just means, how often am I going to do this? You know, like how many times per week? How many times a day? Whatever. That really depends on how many times you want to do it. How much time do you have? How much energy do you have? You know, if once a week is what you got, do once a week. That's great. Over time, frequency is the thing that I would dial up the soonest to get to 2 days a week, 2 sessions per week, because a lot of research supports that really twice a week is considered minimum effective dose of strength training to make strength gains and bone density gains. Okay. So, but if you don't have twice a week, you know, in your life right now, then just do once a week and work up to it. Volume, how much exercise am I going to do per session? How many reps? How many sets? How many exercises? Am I going to do 10 different ones? Or am I just going to do 4 different ones, or maybe just 2? Again, depends on time, depends on energy, your ability to recover. But in general, taken as a whole, your program should include all of those functional movement categories to be well-rounded. And in general, also somewhere between 10 and 20 sets of strength exercises per week are that's thought to be the sweet spot, optimal for strength gains. Now, fewer can definitely also be beneficial and sufficient. But beyond that, more doesn't seem to be all that much more helpful, okay? So a set is like, maybe I'll do 10 repetitions of an exercise, 10 deadlifts. That's a set, okay? So 10 to 20 sets per week. I probably do closer to like 15 or something like that. I mean, it's not a huge volume. I keep my volume pretty low because I have some recovery challenges due to my health conditions. But you know, how many reps per set is another question that we could spend all day talking about. But I'll just say, in general, higher reps, say 10 to 20 repetitions of an exercise, are usually used when you have more like muscle endurance goals. But if you have strength goals, lower reps are usually what's used. Anywhere from 3 to 8 repetitions are usually for strength training gains. All right. Intensity. How hard should I be working? Well, another good question. But for strength training to be effective, it needs to be progressive. That's the main concept. So this is going to be based on rate of perceived exertion, which is I'm about to explain to you. And most of our desired outcomes, whether it's bone density gains or really strength gains, do occur at higher intensities, meaning we're working harder. Heavier loads are necessary for bone density adaptations and strength gains. But we always want to progress the intensity very slowly so that we're sure we can adapt along the way. I'm not going to start out with a 100-pound deadlift. I'm going to start with whatever, 10 or 20 pounds, right? Something that feels pretty easy. And then I'm going to progress it very slowly over a long time until over time, it's going to become heavy for me. Okay. But we want to do that slowly. So let me tell you a little bit more about RPE, because this is such an important guide to help you know how hard you're working and how hard you're targeting to work. It's super important, okay? It's your subjective sense of your effort. That's what RPE is, rate of perceived exertion. It's based on a scale of 1 to 10, based on what are your reps in reserve. In other words, when you finish a set of exercises, when I finish 10 deadlifts, the question I want to ask myself is, how many more could I have done just now, but I didn't, okay? How many reps I've got left in my tank, I'm going to subtract that from 10 to get my RPE. So as an example, an RPE of 5 is moderate effort, middle of the road, okay? It means when I finish my set, I still got 5 left in the tank. I could have done 5 more reps, but I didn't. I stopped, okay? That's an RPE of 5. An RPE of 9 means when I finish my set of exercises, I could eke out 1 more rep. I've got 1 more in the tank, but that's it, because that was dang heavy, okay? So that gives you an idea. An RPE of 7 means I finished my set, I got 3 in the tank, okay? Funny thing about RPE is it's based on your own subjective assessment of this. Do you think that's accurate? No, it's not. But we get better at assessing that over time. So RPE in and of itself is a proprioceptive challenge for us to even know how hard we're working. It's just another reason why I think it's important to practice it, because you'll get better at it. So workout intensity examples for you, it is important to progress training intensity over a training cycle, because the body actually does require constant challenge in order to continue to adapt. It has to have a stimulus. Okay, bodies don't just get stronger. They don't just learn to do things better without having the right kind of stimulus, okay? Bones get bored. They stop adapting. Muscles get bored. They stop adapting. I wish that wasn't the case, but turns out it is. You know, it's the best that we understand right now anyway. So we start with lower RPE and we progress to higher RPEs over a training cycle. But then we have to build in time for deloading, unloading the body, taking a week for just walking, doing lower effort activities, because we have to recover. We can't always train at an RPE of 8 or 9. We cannot. We'll be overtraining. We'll be setting ourselves up for injury. So even though we need to spend some time at heavier loads, and heavy is totally subjective for each of us. It's what feels hard for you, you know? We can't stay there forever. We have to kind of progress up to it and then take a little break, and then progress up to it and then take a little break. So I'll show you that. Actually, I'll come back to that slide in a minute, but here's an example of a training cycle. This is where things get a little complicated. I know that, but just take it in and let it be planting some seeds for you. All right, because this is where you really understand that strength training is not haphazard at all. It's really well thought out. It's programmed. Let's consider a 4-week training cycle. It's 4 to 6 weeks, something like that would be good. So let's say week 1, I'm going to choose, well, for this whole training cycle, for this month, I'm going to choose 3 or 4 strength exercises twice a week. Okay. I'm going to progress those same exercises the whole month. So I get heavier and heavier and heavier. Week 1, I'm going to aim for 8 to 10 reps per set. I'm going to do 3 or 4 sets of each of these. Okay. This is just an example, but week 1, I'm going to do 8 to 10 reps per set. I'm aiming at an RPE of a 5 or a 6, right? So that's moderate. Week 1 is moderate. I'm going to do 8 to 10 deadlifts at a weight that leaves me feeling like I still could have done 4 or 5 more. Week 2, I'm turning things up a little bit. Dropping my reps. I'm doing 6 to 8 reps per set this time, but it's heavier. And I'm only leaving 3 or 4 in the tank now. All right, week 3, little heavier, 4 to 6 reps per set. I'm only leaving 2 or 3 in the tank. Week 4, 3 to 5 reps per set. I might do 3 deadlifts, but they're so heavy, I've only got 1 or 2 left in the tank. Right? Then I'm deloading. I'm taking a week where I'm doing really low RPEs, maybe some resistance bands, maybe going to some yoga classes, whatever, right? I'm recovering. And then I'm going to begin another training cycle with maybe a different variety of exercises that I'm going to get to progress over this next cycle, and so on and so forth. Okay. So that's just a really broad brushstrokes example of what a training cycle sometimes looks like. This is what mine usually looks like. Okay. Most people require some months to even arrive at a place where they feel like they're getting to an RPE of about 5, because you have to progress there. You know, you're going to have a lot left in the tank if you're using 5-pound weights, most of you. It depends on where we're starting for sure. But in a lot of cases, it's going to take you a while to build up to the amount of weight that leaves you feeling like, gosh, I just did 10 of those, and I actually only think I could do 5 more, because that's kind of already moderately heavy already when you get there. Okay. So this is very much a process to build up to. But a lot of people ask, well, how much should I increase each week? You know, if I'm lifting 20 pounds this week, well, what should I do next week? Depends so much. Okay. But in general, really broad category suggestion is for lower body exercises like squats and lifts, that you don't increase by more than 5 or 10 pounds per week. Okay. So, you know, that's not a ton. So this is going to gives you an idea of like how slowly you're really building up your weights here. For upper body exercises like pushing and pulling, they're not as heavy because we're not as strong up here. Usually the recommendation is don't increase by more than 2.5 to 5 pounds per week. So little incremental increases, which means you got to have lots of small weight increments available to you. That can be costly and takes up some space and it's hard to figure out. But this is a picture of a 1-pound plate. That's awesome. I love being able to turn up the intensity on an exercise by just 1 or 2 pounds at a time. Sometimes that slower progression is really important, especially if you have hypermobility. Okay. And then lastly, recovery. So adequate rest between sets, super important. And after the session, I would really encourage you to take Shavasana after your workout session and relax, do some yummy stretching, do some rolling on whatever you like, foam rollers, therapy balls, you know, really get your nervous system down to baseline, just like you do after a yoga class. It goes a long way to support recovery. Be willing to modify your workouts based on all the factors that we know influence our recovery and performance, like nutrition, hydration, sleep, stress. Hugely important. If you didn't sleep last night, today is not a day to push your RPE. It's just not. It's not going to go well. You're at risk for more injury. So you got to be willing to modify and adapt along the way. And then figure out how your body responds to these things by tracking your recovery. We need a 2 or 3 day study after a workout session to really know how it went for us, you know, and never progress at the risk of your recovery. If you're getting really, really sore, really, really fatigued, just wiped out, you're not recovering. That was too much. Okay. And so dial it back and take a slower progression. We never want to progress things at the risk of that recovery. Okay. Emphasize increased fuel for your exercise, more calories, more protein, more hydration, more electrolytes. I drink a ton of salt water, for example. Okay. So I want to say just a few quick words. I know we're coming down to just a few minutes left, and I just have a few more slides. So I want to say a few words about hypermobility syndromes, because it can complicate things. And as yoga people, many of you probably are also bendy. People with hypermobility syndromes like hypermobility spectrum disorder, hypermobile Ehlers-Danlos syndrome, can really complicate strength training for you. Connective tissue laxity means bendy people rely more heavily on muscular support, period. So most people know they need to get stronger. Problem is, when they try, they often overdo it. They have more pain, more fatigue, and it gets complicated, and they might be afraid of loading their tissues because of past messaging they've received or past experiences. But the reality is the hypermobile body is generally chronically underloaded. It has not been given the stimulus it needs to make an adaptation and get stronger. So it's really important that we load it, and they are adaptable. We just have to find that right amount that challenges this body without overdoing it. And that, again, that takes time. It takes trial and error. It takes studying to really find out what is that right amount of challenge that stimulates a response without a setback. Very tricky. But the small amount of research that we do have on bendy people lifting is very positive. It suggests that, yes, we can do it, we can adapt, we can get stronger, and we can tolerate it well. And our connective tissue can get stronger. So some key principles, just this one slide, is how I would modify everything that I just said. Add this on for hypermobility. Lower starting effort, lower intensity to start, slower progression. All right, there's a thing called the 50% rule, which is if you have a chronic energy limiting condition, make an educated guess of what you can tolerate and then only do half of it, and you might be on the right track, okay? Longer training cycles. All right, sensing RPE accurately is going to be even a bigger challenge. Smaller movements, rein in the range of motion, get control over smaller amount of range, really important first, and then bring that control with you as you do bigger movements, but start small. Slower movements, avoid momentum, slow your movements down, use a metronome if you need to, a metronome app on your phone. Heavier loads often helps the brain connect with the target muscles better. Sensory input like taping, like a mirror, like feedback, like a weighted vest can help give your brain more input to understand what's happening in the body better as well. And even more emphasis on recovery, okay? Longer recovery time, more TLC for this body after each session. Here are some precautions if you have unstable joints that dislocate, that may be a reason to get some guidance on board for your strength training for sure. Know that we can have decreased proprioception. Momentum is where we're going to get injured. Like kettlebell swing is an example. Not a terrible activity necessarily, but it's a momentum example. We're going to fatigue early. And then when we're fatigued, we're going to compensate with the wrong muscles. So we might need like 1 or 2 or 3 repetitions of an exercise, and then we're fatigued. So be willing to go really low reps. And the effects of some of our co-occurring conditions can be a problem too. Okay, key takeaways here. Strength training is awesome. Can really enhance your life, I think, in a lot of ways. I think it can give you some benefits that yoga simply cannot give. But get guidance as needed for sure, okay? At least to start out with. Start slow, progress, start low, go slow. Think functional. Doesn't need to be fancy. It just needs to be consistent and progressive, okay? Recovery is paramount, and your willingness to modify based on your day-to-day changing needs is super important. We do have some time for some questions, so I'm going to take these slides down, but you will here's some ways to keep in touch with me and get on my email list, but you'll get a follow-up email with a lot of this stuff in it as well. Okay, so you will have that. All right, but my website is just libbyhinsley.com. That's super easy. You can go there and get on my email list. I'm going to try to come back to you. Where are you? There you are. Okay.
Hello.
Yeah.
Amazing. We have such great feedback. The chat was just on fire the whole time. So
Cool.
We have so many questions to get through, actually. I'm going to start right at the top with Fern. We had a question come in. Should yogis be bringing, oops, I lost it. 1 second. Should yogis be bringing strength training into yoga practice if they're still working on their form? My concern is building muscle that develops poor form and postures.
Well, I mean, that's where you want, if you're bringing in strength training into yoga, you want to have, you want to know what you're doing. So as far as technique goes, technique is really important with strength training. What's more important, though, than technique is neuromuscular connections, really knowing where the brain should be connecting to. So a classic example of a hypermobile person is they might be doing a task on the outside. It looks perfect. It's so beautiful, perfect form. But what's going on between the brain and the body is all kinds of wonky, and you won't see it necessarily. So there's kind of two layers: technique and form, yes, and also neuromuscular kind of connections, making sure those are happening. So it is tricky, requires a different skill set. Yeah, so you want to get that.
Awesome. Let's see here. Question from Stephanie. At what point are prolonged and loaded stretches concerning for cartilage, ligaments, or tendons?
I think they're more concerning as far as, I mean, this is such a tricky question. We could talk for an hour about it. And it really has to do with connective tissue's response to loading. We know that connective tissue responds by getting stronger. But some people, hypermobile especially, find that prolonged stretching at end range is irritating to their tissues. It is not going to cause hypermobility. It will not destabilize things further, for example, but sometimes it's an irritant. It's hard to explain why that is. I think it's a sensory issue. I think it's a nervous system issue more than it is a mechanical issue. We also know, though, that those tissues are more at risk for sprains and strains. But if you take an example of like a forward fold, standing forward fold, I could fold over and hang out there stretching my hamstrings for the next 30 minutes with my body weight. For me, that would be kind of irritating. However, if I pick up a 100-pound barbell and do a deadlift and lower it back down to the floor, I am doing now a hamstring stretch, not holding it for as long, but it's way more loaded. So there are all these load parameters that change between different tasks, and they all matter, and they're really not that well understood, right? The duration of the load, the magnitude of the load, the frequency of the load, these all are going to play into that. So it's really hard question to answer.
Question from Nancy. How do we adapt these concepts to yoga practice, such as the Fishman 12 poses for osteoporosis?
I mean, you can do those poses, but those poses compared to strength training, they're going to lose. So, I mean, if you're thinking about bone density, that's a yoga program specifically designed to stimulate bone density gains. What all the research points to is that your bones require relative progressive stimulus. If you have been on your couch for the past 5 years, yoga asana will be adequately stimulating for your bones to create adaptations. But if you have not been on your couch for the last 5 years, you're going to need more than asana. Or if you've been practicing asana, you need progressive overload. And whatever it is you're doing, it has to get harder. So once your bones adapt to that thing, they stop adapting. They plateau. And now you need to add more. And now you need to add more and more and more and more. So that's really what we know. It's all relative to what are your bones used to. But for most of us, active humans, asana is not going to be enough to optimize bone density gains. Those are going to happen at higher RPEs. And I mean like RPE of 8, 7 or 8, like heavy. Okay, that's what the research really points to.
Question from Rosie. Do you recommend doing the same 4 to 5 exercises in the 4 to 6 week period, progressively adding the weight, or any combo of lift, push, pull, etc.?
You could do it either way. So what I usually do is I do the same exercises for about a month, but I'll have 2 lifting days. So like on Tuesday, I'll do these 3 or 4. On Thursday, I'll do a different 3 or 4, but I'm always getting all those categories and I'll progress those for the month. And then the next month I might do different variations on squat, lift, push, pull. So instead of overhead press, maybe I'll do a bench press. Instead of a bent over row, maybe I'll do a pull down. Instead of a single leg deadlift, I'll do a sumo deadlift. So I'm always trying to mix in those, but each training block for me, 4 weeks or so, I'm sticking with the same one so that I can progress them.
Question from Rinia. Do you have techniques you use for working with scoliosis imbalances common with hypermobile folks?
Yeah, not like super tedious ones. Depends on how severe your scoliosis is. If it was really severe, I probably work with someone who was a real, gets into those really tedious, nitty gritty things. But, in general, with scoliosis, broad brush strokes, side plank goes a long way. Side planks all the time. I would really incorporate that into like a warm up as one of my warm up exercises all the time, and working on overall functional strength. Scoliosis, if it's not super severe, doesn't have to be a big limiter necessarily of your activity. Again, it depends on the situation, but you're right, it's very common with hypermobility.
Question from Paula. Do you think calisthenia could be a good way to add strength to a yoga routine?
I don't know anything about calisthenia. That's an interesting word. I've never heard of it. I don't know.
We'll look into that.
Yeah. Anything that gives you extra external load, any resistance, all resistance is good resistance as far as I'm concerned, as long as progressive and consistent. That's what your body wants.
A question from Teeny.
Yeah, I don't know.
I would love to add resistance bands to my senior yoga class. Where can I find more info for the poses?
In your own practice, you could probably get some books. I'm thinking, is it Laurel Beversdorf? Maybe has some, she has a lot of cool stuff actually, but I feel like she might have a program on resistance bands and yoga. But what I would do if I wanted to do that is do your yoga practice and get crazy, get creative with some resistance bands and see what you can come up with. I think that would be really fun actually. And you'll come up with a lot of good stuff.
I think we had a comment come in from Krishna. I think she meant calisthenics.
Yeah, I don't know. I think of calisthenics like gymnastics, I don't really know exactly what you mean by that, but anything's going to be limited if it doesn't involve external load, something that gives us more resistance. Again, if we're starting on the couch, anything's better than nothing, right? But remember that it's relative to what your tissues are already accustomed to. Hi, Tommy.
Awesome. Question from Paula. Do you recommend to change your training routine based on your menstrual cycle?
Only if you find that that's real relevant for you. I haven't not found that it's super relevant at this point in my life. I still do have a cycle that's regular, but I find that, everyone's a little different that way. And certainly if my cycle affects my energy levels or my sleep quality, then that's going to play into my training. And it also is going to affect hypermobility. So people who find that their joints, feel less stable at different times of the month, yeah, you may want to time that accordingly. So let's say you're on a month-long training cycle, you might want to time your deload week to land where you need it to land in your cycle. But I would do that based on what you learn about yourself personally. But I don't think there's great evidence across the board to really support that, which is weird for a lot of people to hear. It really is. I know that, but.
Awesome. Question from Nancy. The examples provided were for shoulders and arms. For osteoporosis, we want to target hips and spine. What are some safe exercises to strengthen the spine?
Yeah, so in strength training world, it's the squats and the lifts. But I would argue that loading the arms is really important too, because of the risk for fracture, with wrists and stuff. But yes, hips and spine, it's about the heavy deadlifts and the squats all the way. Those two things. And if you are interested in that, you could look up a study called Lift More. It's LIFTMOR, the Lift More study. It was a study really cool with heavy lifting in postmenopausal women with low bone density. And it was really cool findings. The people that were lifting heavy did awesome. And the people who were lifting less heavy did less awesome with their bone density gain. So look up that study. It's really cool.
Awesome. Question from Alice. Let's see here. Where was it? Is RPE linked to how you feel in the moment or to how you feel the next day, the next hour/day? Since recovery and fatigue take so much time with EDS.
Yeah, RPE is about that moment, Alice, but this does complicate things. So recovery being challenging for EDS, especially if you got MCAS and POTS and all those things, you're going to have to study that and really learn what the sensations in your body mean for you, and that's a trial and error process. But sometimes the EDS person wakes up one morning, it turns out they had planned for it to be their heavy week, right? RPE of 8 or 9, not happening, right? Because they just don't have the energy for that. So we have to modify, and that is okay. It's just you prioritize your recovery always. Don't ever progress your training at the risk of your ability to show up in your life as a human being, that you have responsibilities like for your kids and your job. Like those are paramount. Those have to be more important. Yeah.
Awesome. We have 2 more questions, then we do have to end the webinar. Question from Enrico. Do you have any resources you recommend regarding breath work and breath instructions? I'm hoping to grow great comprehensive insight in the process of breath in this life.
Yeah, I would look into Vinny yoga. So the tradition of yoga that I'm kind of most interested in is the Vinny yoga lineage. Gary Kraftsow is one big main teachers in that lineage, but that's very breath centric type of yoga practice. And you may find, if you go digging, a friend of mine here in town, Subtle Yoga, Christine Weber, she's got another, she's kind of in that similar lineage and does a lot with breath. So I'd go down that rabbit hole on the breath work.
Awesome. Last question from Kathleen. Are the 10 to 20 sets per each exercise, example squat, push, pull, or overall?
Total.
Total.
Yeah, total. Yeah. And if you look up that research, you'll find very wide range about what kind of volume you need to make gains. It's all over the place, honestly. So make it fit your life. Don't get too caught up on those details, is what I would say. And what else was I going to say about that? The same goes for rep ranges. Sometimes you'll see like muscle hypertrophy, which means growing muscle has to be 8 to 12 reps. That's not actually true. We know that these days. It's not true anymore. You can build muscle at 5 reps. You can build muscle at 20 reps. What's more important is that it's progressive overload. So that concept is really, really, has to stay important, central. Yeah. And someone mentioned the body braid. It's a great tool to give extra input. So when I mentioned that bendy people sometimes need more like sensory input in order to connect with the right muscles, that's a great example, is the body braid. It's like a wearable whole thing. It's cool. Yeah.
Awesome. We're going to go ahead and wrap up today's session. Thank you again so much to everyone that attended, taking time out of your busy day to be here with us. It's so special, and we very much appreciate all of you. Thank you so much, Libby, for your time and for this awesome presentation. We have amazing feedback in the chat, so thank you so, so much.
Yeah.
Again, the webinar recording will be sent via email. We'll also include all of Libby's links. There will also be information on how to get your Yoga Alliance credit for this session. So more details to come again in that email. And thank you again so, so much.
Yeah, and everybody, thank you so much for spending some time with me today. I do have you'll get the link for my next online strength training series for hypermobile people and anyone else too. So hope you'll jump in if you've been inspired. But yeah, thanks for being here and keep in touch.
Thanks, everyone. Have a great week.
Bye.